Welcome to our video tip on Are You Slapping Pet Owners with Sticker Shock? This is Wendy Myers with Communication Solutions for Veterinarians in Denver, Colorado, where we help practice teams with compliance, communication skills, and client service. We offer monthly CE credit webinars, and you can get information on our upcoming topics at csvets.com. We're also one of the largest phone skills training providers in the veterinary profession, having trained nearly 5,000 veterinary teams in both the U.S. and in Canada. So as we look at our tip on sticker shock today, I want to talk to you about the need to communicate value for veterinary care. Because in the Bayer Veterinary Care Usage Study, the pet owners that were surveyed, 34% of those said that their veterinary bill is actually higher than they anticipated. So what do people typically spend on a preventive checkup? Well, according to the American Animal Hospital Association's Veterinary Fee Reference, and this is the 9th edition that was published in 2015, a client with an adult dog who is age 1 to 6 typically is going to spend around $107 for her dog's preventive care exam, also for a distemper rabies vaccination, and then a heartworm and intestinal parasite test. Now, add on to those professional services 12 months of flea, tick, and heartworm prevention with an average cost per dose of $25 totals up to $300 for a year's supply. So in many clients, their perception is that they went to the vet today and they spent over $400 just to get shots. So I want to walk you through an example of a communication makeover. During an on-site consultation at a practice that I was shadowing an appointment from start to finish, I observed a client who was completely happy with that day's visit until she went to pay for services, and this is where she got slapped because her 6-year-old bulldog that day had a complete checkup, exam, vaccines, diagnostics, and then refills on 12 months of flea, tick, and heartworm prevention. And as the client approached the receptionist to pay for today's services, all the receptionist said to her was, "That'll be $302 today." A little bit shocked and stinging from the slap, the client replied with, "Wow, that's as much as my car payment." And this receptionist did a very poor job of communicating value. So one of the keys for your team to do is to always present service before price. And what I encourage you to do is to read off the computer screen each of the services and products that the client is purchasing today, and then state the total last. And this is going to help you communicate value rather than sticker shock. So let me give you an example of a script of how this would sound in a client conversation. So you would say, today your dog had a preventive care exam, vaccines, an intestinal parasite screen, and a heartworm tick screen. So I've now covered all of the professional services. You also have refills on your dog's flea, tick, and heartworm preventatives. Do you need any other medications or food while you're here today? And the reason I have you ask that at checkout is because the research from the American Veterinary Medical Association shows that the average pet owner today in the United States has 1.5 pets. So most people are in a multi-pet family, and they may be visiting here with their dog today, but they also maybe have 2 cats at home and need refills on a therapeutic diet or medication for one of their cats. Then you are going to state the total, and then you're going to ask which payment method will you use today. And this is a very subtle yet professional way to indicate that payment is due at the time of service. Now, when you're checking out a new client, I also like for your team to share which payment choices you accept. So you would explain that you accept cash checks, all major credit cards, and then any third-party financing programs that you have. Now, when you take this proactive approach to showing value, there's a significant benefit to yourself. Being a veterinary receptionist can be a highly stressful job. So which of these 2 choices would you rather hear during checkout? Because you'll check out, maybe 50 clients today. Which would you rather hear? "Wow, is that all?" Or, "Wow, it's how much?" So make sure you do a great job in proactively promoting the value of your veterinary care. You can get more information on how to talk to clients about money in our webinar, which you can find at csvets.com. And we also hope that you'll join us for future webinars as well as some of our monthly YouTube tips. We hope this has been helpful. Thanks, everyone. Have a great day.